Hello and welcome to 아리랑tv special coverage of COVID-19. I'm Min Sun-hee. President Moon Jae-in became the first sitting Korean leader to deliver a keynote speech at the World Health Assembly on May 18th via video. He spoke of Koreans making a bold move by taking their individual freedom, that is, and turning it into an even greater freedom for all as part of efforts to combat the pandemic via openness, transparency, and democracy. Let's take a listen to his words, which were pre-recorded and played at the top global health forum.
It's my pleasure to now invite the President of the Republic of Korea, His Excellency President Moon Jae-in. You have the floor, Excellency.
존경하는 의장님, 사무총장님, 각국 대표단 여러분, 코로나를 극복하고 새로운 희망을 만들기 위한 세계보건총회에 함께하게 되어 뜻깊습니다. 먼저 전 세계에서 코로나로 희생되신 많은 분들께 진심으로 애도와 위로의 마음을 전합니다. 또한 인류의 건강과 안전을 위해 헌신하고 있는 모든 나라의 의료진과 방역진에게 깊은 존경과 감사의 말씀을 드립니다. 나는 오늘 코로나를 이기기 위해 대한민국 국민이 선택한 모두를 위한 자유의 길을 소개하고자 합니다. 한국은 코로나의 피해를 가장 먼저 입은 나라 중 하나였고 공격적인 바이러스에 대응하는 해결책을 빠르게 찾아내야만 했습니다. 도전과 위기의 순간 한국 국민들은 담대한 선택을 했습니다. 개개인이 가지고 있는 자유를 모두를 위한 자유로 확장시켰습니다. 이웃을 바이러스를 전파하는 위험한 대상으로 여기고 봉쇄하고 차단하는 대신 나의 안전을 위해 이웃의 안전을 먼저 지켰습니다. 자유롭게 이동하고 경제활동을 지속하기 위해 자발적으로 마스크를 착용하고 사회적 거리두기에 적극 참여했습니다. 사회적 거리두기 속에서도 서로의 마음은 더욱 가까워졌습니다. 의료인들은 자원봉사로 혼신의 노력을 다했고 시민들은 나눔으로 격려했습니다. 전국 단위의 총선거에서는 엄격한 방역 절차에도 불구하고 2,900만 명이 넘는 유권자가 투표에 참여했습니다. 평상시보다 더욱 높은 투표율을 기록하면서도 한 명의 감염자 없이 민주주의의 축제를 만들어냈습니다. 이웃의 범위는 국경 너머로까지 확장되었습니다. 국경을 막지 않고 교류를 계속하는 한편 형편이 허용하는 대로 진단키트와 마스크를 비롯한 방역 물품을 나누었습니다. 높은 시민의식으로 모두를 위한 자유의 정신을 실천하며 방역의 주체가 되어준 국민들 덕분에 개방성, 투명성, 민주성의 3대 원칙이 힘을 발휘할 수 있었습니다. 정부도 신속하고 광범위한 진단검사와 창의적인 방식으로 국민의 노력을 뒷받침했습니다. 한국이 코로나에 아직 완전히 승리한 것은 아닙니다. 사회적 거리두기를 생활 속 거리두기로 전환하여 일상과 방역이 공존하도록 노력하고 있지만 아직도 산발적인 집단 감염이 이어지고 있습니다. 또한 국외에서 계속되고 있는 세계적인 대유행이 여전히 위협적입니다. 치료제와 백신이 준비되지 않는다면 또다시 새로운 대유행이 올 수도 있습니다. 그러나 우리는 분명히 알고 있습니다. 정보를 공유하고 함께 협력하는 힘은 바이러스가 갖지 못한 인류만의 힘입니다. 코로나는 인류 공동의 가치인 자유의 정신까지 위협하지만 자유의 정신에 기반한 연대와 협력이야말로 코로나와의 전쟁에서 승리할 수 있는 가장 강력한 무기입니다. 의장님, 각국 대표단 여러분, 나는 모두를 위한 자유의 정신에 입각하여 세계가 지금의 위기를 극복하고 그 이후를 대비하기 위한 세 가지 제안을 하고자 합니다. 첫째, 보건 취약국가에 대한 인도적 지원을 확대하고 방역 경험을 공유해 나가야 합니다. 모두가 코로나에서 자유로워질 때까지 단 한 사람도 소외되지 않도록 함께 협력해야 합니다. 한국은 올해 총 1억 불 규모의 인도적 지원을 계획하고 있습니다. 위기 대응과 출입국 정책에 이르기까지 그동안 축적해온 경험과 데이터도 지속적으로 국제사회와 공유해 나갈 것입니다. 인류의 건강을 함께 지키기 위해 WHO와 적극 협력해 나갈 것입니다. 둘째, 백신과 치료제 개발을 위해 국경을 넘어 협력해야 합니다. 개발된 백신과 치료제는 인류를 위한 공공재로서 전 세계에 공평하게 보급되어야 할 것입니다. 한국은 백신과 치료제 개발을 위한 WHO의 노력을 전적으로 지지합니다. 한국은 세계 백신 면역 연합, 글로벌 펀드, 국제의약품 구매기구, 국제 백신 연구소의 공여국으로 참여하고 있으며 올해부터 감염병 혁신 연합에도 기여할 예정입니다. 셋째, WHO 국제보건 규칙을 비롯한 관련 규범을 빠르게 정비하고 기속력을 갖춰야 합니다. 우리는 언제라도 올 수 있는 신종 감염병 위기에 보다 신속하고 효과적으로 대응할 수 있어야 합니다. 감염병 관련 정보를 국가 간에 더욱 투명하게 공개하고 조기 경보 시스템과 협력 체계를 공동으로 구축하는 노력이 필요합니다. G20 정상회의와 아세안 플러스 3 정상회의에서 논의된 협력 방안들이 더욱 구체화될 수 있기를 바랍니다. 존경하는 의장님, 사무총장님, 각국 대표단 여러분, 위기 앞에서 인류는 각자 도생이 아니라 연대와 협력을 선택해야 합니다. 위기일수록 세계는 상호 신뢰와 포용으로 단합해야 합니다. 국제사회가 모두를 위한 자유의 가치를 더욱 굳게 공유한다면 우리는 지금의 위기 극복을 앞당기고 포스트 코로나 시대의 희망을 더 크게 키울 수 있을 것이라고 믿습니다. 감사합니다.
Right, that was President Moon Jae-in addressing the Global Health Forum amid the pandemic yesterday and calling for a unified response to the COVID-19 outbreak here in the world. Now let's start with the domestic updates then, Suha.
All right, well, we do have another drop in new cases compared to yesterday, but we have those concerns of sporadic cluster infections, just like President Moon Jae-in just mentioned in the speech as well. But before we get into those details, let's take a look at our graph here. We have 13 new cases as of this Tuesday, and that is a slight drop from yesterday and also the days before when we were in the 20s. So that brings our total number of confirmed cases to 11,078. But we have no death reported today. Let's take a look at our next table. And 877 are still in quarantine, and more than 9,930 people have fully recovered. And now let's take a look at our map by region. The latest infections occurred mainly in and around the capital, with 6 in the capital Seoul, 1 in Gyeonggi-do province, and 2 in Incheon. And in the city of Ulsan, we see 4 new cases down south. And out of the 13 new cases, 4 were imported cases, and the rest were domestic infections.
I see. What about the situation overseas, Suha?
Well, for that, let's take a look at our table here which shows our major outbreaks around the world. The U.S. has 1.5 million cases with more than 91,000 deaths, and Russia is close behind with more than 290,000 cases. And Brazil had less cases than the UK just a day ago, but now is here 4th. And another notable case, India has more than 100,000 cases now.
I see. So I'll come back to you for the domestic updates after we take a look at this regular briefing.
Let us now begin our regular briefing for May 19th, Tuesday, on the coronavirus outbreak. We have 13 new cases, and the total number of confirmed cases now stands at 11,078. This includes 1,181 imported cases, and 89.2% of them are Korean nationals. And we have 34 more people making full recovery, and a total of 9,938 have been discharged. And a total of 877 are in quarantine. And the death toll remains unchanged from yesterday. However, as some of the media have reported, we have one fatality from those who have recovered, and thus we send our deepest condolences to the deceased and the members of the bereaved families. Out of the 13 new cases, we had 4 imported cases, and these 4 cases, all of them were from the Americas. And as for the locally transmitted cases, there were 9 as of yesterday, and 7 were relation to the club cluster infection, 1 in Seoul, and also 1 was the contact of this person. And in Seoul, we had 1 case which was at the Samsung Medical Center, and we have 3 more confirmed cases from this person, and we are also conducting our investigation and infection control measures currently, and we will provide you with the updates as soon as we have them. And 7 of the club-related cases, 5 of them are visitors to the club, and the rest 2 are the contacts. And as of noon this morning, we have 12 new cases related to the club, and the total stands at 187. And the visitors amount to 93, and the contacts amount to 94, making it higher than the number of club visitors. And we are looking at the case in the Incheon, Michuho, and we are also identified that this contact has a confirmed case has been using the coin singing rooms as well as the elevators in this building midnight of May 6th. And if you were at these facilities at the same time, we advise you to get screening testings as soon as possible. And we also highlight that anyone who visited any of the nightlife entertainment venues in Itaewon area, including any clubs or bars from 24th of April to 6th of May, to stay home and refrain from going to other places, contact a local public health center or dial 1339 and visit a screening clinic and get tested regardless of symptoms. We say this multiple times, but we also emphasize that people who work in education, places of worship, indoor sports facilities, or other places that are used by many people should especially report to public health center if they have been exposed to above venues, since their work environment creates a high risk of transmission. And the KCDC, we also would like to stress, in light with the school opening for the high school seniors, we have a few words for the public. And ahead of the reopening, we will have a hotline established in the local municipal education offices and the education ministry. And we will also continue to have a close cooperation between related institutions so that we can share information on a very fast pace. And all of the students and the faculty members, they will be tested for, they would be monitored for their conditions. And if they feel sick, you should not go to school. And we should highlight also the need of washing your hands and wearing of face masks, as well as other basic quarantine protocols. And at schools, we also recommend that all students and all people need to get their body temperature screened. And if their temperature temperature is above 37.5 degrees, they need to be isolated, and they need to also contact their parents as well. And if we have a confirmed case at a specific school, all of the rest of the people will be isolated, and they will have to wear protective face masks, and they will be returned home immediately. In order to curb the further spread of the virus within schools, we will conduct also samples testings if this is needed, and this will be carried out on a very swift measure. And this has been requested by the quarantine authorities. In addition, for clubs and singing rooms and the private academies, these are the places that we see a high infection of community transmission. We highlight this multiple times, but we ask you to refrain from going to enclosed and crowded spaces. And if you have to visit these facilities, please refrain from having close contacts, and please comply with personal hygiene measures like washing of your hands and wearing of your face masks. And especially persons belonging to high-risk groups, including elderly, pregnant women, persons with chronic illnesses, should especially avoid any poorly ventilated enclosed space frequented by many people. If such a situation cannot be avoided for an essential reason, it is highly important to wear a protective face mask. Last but not least, the quarantine authorities, we have highlighted that the post-coronavirus era will be different from the days before. And we also ask the members of the public to be disciplined and to stay vigilant and to change your ways of a daily routine. And thanks to your awareness and swift reporting of the medical staff and the Seoul cities, as well as the metropolitan area, and the local governments participating in such measures, as well as expansive testing, including the anonymous testings, and such innovative measures that we have put in place have actually been very effective in closing and disrupting the chains of community infection. And we are still witnessing some of the sporadic outbreaks whose sources are not yet identified, and we will continue to carry out the diagnostic testings going forward. And as for the quarantine measures, we believe we will have another big hurdle ahead of us, as tomorrow we will have the school openings for the high school seniors. And up until now, each schools and the related institutions have prepared in their full-fledged to carry out offline classes for these students. And we also had the screening measures in place, and all of these schools also put in place effective measures for prevention. And people have also carried out close monitoring of their health at their homes. And if we have an outbreak at schools, we will return back to online classes. However, tomorrow is the actual day where our new school offline classes begin, and we believe there could be some confusions in place at the early stage, and we need to deal with these measures. And we believe that this early stage will be a time for us to supplement any of the areas that are lacking. We believe we will have a very diverse scenarios unfolding starting from tomorrow. We could have unexpected cases, and we could see a confirmed case among students, faculty members, as well as teachers. And we believe that it will be inevitable for us to avoid such confusion in the beginning. However, as we did in other sectors so far, we need to act swiftly, and we have been controlling the outbreak to a certain extent. And based on a very strict preparation, we have confidence that we could overcome any of the challenges that lie ahead. Last but not least, if there is an outbreak of confirmed case at schools, all of us need to become and share the minds of the parents, and we should not let our students who have been confirmed to be encountering any stigma or discrimination from the public. We need to cooperate going forward, and we believe that our only enemy is the virus and not our discrimination or stigmatization. And we believe and we hope that we can make a world where we do not have a discrimination against other people, and including students. Thank you very much.
Right, that was the government's afternoon briefing on the COVID-19 situation here in Korea. Do give us a summary of the key announcements, Hoa.
All right, well, there is a concern here in the capital, Seoul, now of a new outbreak of a cluster infection because one of the major hospitals in Seoul, the Samsung Medical Center, had one nurse that was first confirmed, and that nurse was said to have been working at the cardiothoracic operating rooms, and now that number jumped to 4 nurses, so that could rise in the future. So there is a lot of vigilance regarding that case. Meanwhile, the number of people who tested positive in relation to the Itaewon club infection, that stands at 187 now, with 93 people having been club visitors and 94 are other contacts, which means the number of so-called chain transmissions is now higher than the number of directly infected people. There were also 4 imported cases, which all appear to be from the Americas as of this Tuesday. And Kwon Jun-wook, the vice head of the KCDC, stressed that there needs to be thorough measures implemented beginning tomorrow because schools are to reopen. They are scheduled to reopen for seniors at high schools, and that after a number of extensions that we had earlier. And these measures will include temperature checks of all students as well as the teachers, and if any of them feel sick, they should stay home. And this because there is going to be a lot of confusion at the beginning of the early stages when teachers and students return to school. And if the situation worsens, they could return back to online classes. So there needs to be a lot of attention on the very first day tomorrow.
All right, Swa, thank you for that. We'll see you again tomorrow.
Thank you.
On the international front, Russia is battling the world's second largest number of COVID-19 cases. For more on the situation in that country, I have on the line Oh Sung-hwan, the Consul General of Korea in Vladivostok. Hello, Mr. Oh.
Good afternoon.
Let's begin with the latest in Russia. Why has there been such a dramatic surge in the number of cases there?
As of today, Russia has 290,000 cases, ranking second in the world. Since the beginning of May, about 10,000 new cases has been registered daily. But from a couple of days ago, there are good signals that epidemic is stabilizing. Of course, there is big difference between western part of Russia and its far east. Currently, Moscow has about 146,000 confirmed cases, while Primorye province has 1,400 cases. When coronavirus broke out at the early stage, the preventive measures taken by Russia were regarded as successful. However, the coronavirus infection began to spread rapidly in early April. So I think that one of the convincing reasons is the Russians who returned back from the Western Europe, where pandemic was widely spreading. For your reference, the Russian government attributes the increase of confirmed cases to the fact that Russia has conducted extensive testing.
I see. Mr. Oh, given the reality there in Russia right now, I'm assuming its healthcare system is being stretched to its limits. This is the case, of course, worldwide as well. Does Russia have the capacity to respond to this health crisis on its own?
Russia had more time for preparation against coronavirus than other countries, as it is directly bordered by China. And coronavirus infection in the western part of Russia began to spread later than in the Western Europe. So Russia managed to increase substantially medical equipment and supplies more than ever by concentrating and mobilizing industrial resources. But it's still not enough compared to what is required now. When it comes to local governments of Russia, I think their situation might be more or less similar to Moscow.
I understand, Mr. Oh, that local authorities in Russia's far east region of Primorsky Krai have placed an order for Korean test kits. Now, would this be the first such purchase of kits from abroad?
Recently, the Primorye government has shown strong interest in Korean test kits in response to requests by Primorye. The Consul General in Vladivostok has closely worked with Primorye by giving all necessary information, such as the list of Korean test kit producers. And just yesterday, I got information that Primorye imported almost 4,000 Korean coronavirus test kits and delivered them to 18 Primorye medical institutions. The main reason why Primorye chose Korea test kits is that it highly values Korea as a successful model for coronavirus prevention and high standards of technology and high quality of Korean medical products. In addition, the citizens of Primorye have a good feeling towards Korea. Primorye is the nearest Russian province from Korea. Last year, 300,000 Koreans visited Primorye, which represent 38% of foreign visitors and contributed greatly to the economy of Primorye. So it's like virtuous circle. The friendly feeling to Korea leads naturally to the high evaluation for Korean disease control, and eventually it facilitated Primorye to import Korean test kits.
So I'm assuming, Mr. Oh, that Russia's assessment of Korea's containment efforts are quite favorable then?
Yeah. So it's clear that Russia highly regards Korea's disease control measures. It is proved not only in words, but also in practice by importing Korean test kits. In Russia, it seems that testing scale is more important than confirmed cases. Actually, the death rate of Russia is lowest one in the world, 0.9%. In Russia, it's believed that the low death toll is due to the large scale of testing from the early stage. It shows that both Korea and Russia surprisingly have something in common in this regard.
Mr. Oh, it's also been reported that Russian and Chinese leaders have vowed to boost bilateral cooperation in combating COVID-19. Please tell us a bit more about that.
8th of May, on the eve of the 75th anniversary of victory, President Putin spoke on the phone not only with President Xi Jinping, but also other leaders to discuss the global fight against coronavirus. He also talked with President Trump about bilateral cooperation related to the coronavirus. In short, human society shares common interest in the coronavirus issue. So there are two aspects. On the one hand, there is a need to resolve through international cooperation. And on the other hand, each country needs to protect its own citizens as a top priority. So this issue has two-sided nature. Russia, for example, when the first outbreak of coronavirus occurred in China, shut down its border with China earlier than other countries. However, China is now providing medical assistance such as face masks to Primorye. The point is that we should enhance regional cooperation against coronavirus among two Koreas, Russia and China, as neighboring countries in the Northeast Asia, if we really want to protect our citizens.
All right, Ms. Oh, thank you very much for making the time and for sharing your thoughts with us today.
Thank you. Stay strong.
A large COVID-19 cluster infection recently broke out at several bars and clubs in Itaewon, a popular nightlife district in central Seoul. The South Korean government immediately began carrying out anonymous testing while adding more walk-through screening centers in an effort to prevent the situation from spiraling out of control. With quaternary infections now being linked to the original Itaewon outbreak, the need for accurate epidemiological investigations and forecasting methods has become more important than ever before. A team of researchers led by Professor Woo Jong-wook from California State University in Los Angeles have grabbed headlines recently after developing a COVID-19 forecasting model that utilizes artificial intelligence. To better understand how this tool can be employed in the global fight against the COVID-19 pandemic, we now hear from Professor Woo himself to learn more.
Effective decision-making is a critical tool in times of crisis. Accordingly, to help authorities that is, better respond to the COVID-19 pandemic, a group of researchers in the US have devised an analytical tool that forecasts the number of cases and deaths by region. For more on this endeavor, I have Professor Woo Jong-wook from California State University in Los Angeles. Welcome to the program, Professor Woo.
Thank you for inviting.
Professor, let's begin with more details on this interactive data visualization dashboard that you've created.
Yeah, actually, our Big Data AI Center provides a dashboard which has several visual charts, as you see, that is very easy to understand and it's kind of straightforward to play with by time and geolocation. So anyone can select any region on the map to find out the accumulated or daily confirmed cases, including the deaths. And you can see the forecast of the 3 days confirmed and deaths as well. So furthermore, especially in USA, it shows the useful information for each state, such as the fertility rate, the number of tests, and the confirmed rate from the test, the number of cases for 100,000 population. Therefore, you can compare your state, your region with the other states and see how well the government has been treating you in the area.
Professor Woo, what led to the development of this dashboard?
Actually, I want to contribute to the community and make people find out the severity of the situation easily with a visual chart. And my graduate students, Monica and Dalia, and I are curious at the current status and the future trend in the crisis. Therefore, we actually developed the dashboard, mostly targeting the things we want to know.
Professor, I understand that the dashboard can offer a 3-day COVID-19 forecast for a particular city. How will such a calculation be used by health authorities to fight the pandemic, do you think?
Actually, whenever we have a visual chart, people can simply find out if the curve becomes flat or still increasing in the area they're interested in. Especially, it should be helpful for the decision makers to determine if we can reopen the beach, restaurant, club, and park, and etc. So, a 3-day forecast should be very, very helpful to predict the future and current status.
I see. Professor, one final question. Seoul is currently working to contain an outbreak that began at a popular nightlife area here. Based on your forecasts, what are the chances of that outbreak sparking a perhaps second wave of infections in Korea?
You know, actually, the forecast is calculated by the past data, and it's difference between the actual value and the predicted value with about 95% accuracy. Of course, there is always the possibility of a massive breakout or outliers, which happen in clubs and bars nowadays in Korea. But based on the more historic past data prior to this happening in club and bars, the dashboard actually says that there would be 1 through 9 confirmed cases in the next 3 days, unless there are other unknown massive outbreaks. So I could say there is a very low possibility for the second major outbreak in Korea.
That is good to know, Professor. All right, Professor, thank you very much for your time at this and all the best in your future endeavors related to COVID-19.
Thanks again here. Same here.
Amid the COVID-19 pandemic, an infodemic of fake news and misinformation is spreading just as quickly as the virus itself. Infodemic is a hybrid term, combining the words information and pandemic to refer to the propagation of half-truths and false information. So what are some of the most common misconceptions regarding COVID-19? Spraying alcohol or chlorine over your body will not kill the virus. contrary to what some might believe. Using a hairdryer does not work either, and the virus is also known to thrive in warmer climates, unlike rumors suggesting that they can only survive in cold and dry conditions. The infodemic has even led to a flare-up of geopolitical tensions and a rise in anti-vaccination campaigns. With the infodemic threatening to undermine public health and efforts to fight COVID-19, what can be done to stem the global spread of false information?
Now, according to a recent survey conducted by Forbes magazine, 1 out of 5 Americans will choose not to get vaccinated even if a vaccine is developed for COVID-19. Some observers are linking this choice to misinformation regarding vaccination. And this is only but one area of the wider infodemic that is raging across the globe, some with deadly health repercussions. For more on this unfortunate reality, I have Professor Lee Hee-eun from Handong Global University. Welcome, Professor.
Thanks for having me.
And I also have Dr. Karandeep Singh from the Institute of Basic Science, that is. Welcome to the program, Dr. Singh.
Thank you for having me.
Professor, we'll start with you. During his video speech yesterday, President Moon Jae-in highlighted the importance of proper information sharing to allow for a unified and effective response to the global pandemic. The stress on accurate information is tangible here. How severe is the situation of misinformation in the world today?
It's a rather serious problem. So, for example, like a pandemic is a disease that spreads over the global population and spreads over continents and, of course, across countries. So much like an infodemic then is the avalanche of information that comes out as a result of the pandemic, which includes information about its origins, how to contain it, how to cure it. But unfortunately, there's a lot of misinformation, rumors that spread, of course, because of this really serious problem. And so the real issue here is getting out accurate information so that people can properly address the problem. They can address the problems with respect to their loved ones. They can protect themselves, their neighbors, and ultimately to manage the pandemic and ultimately try to mitigate its impact.
Right, and as part of those very efforts, Dr. Singh, your institute has launched a campaign called Facts Before Rumors to ensure that global citizens are properly informed about COVID-19. Please tell us a bit more about this campaign.
Okay, so as Professor Lee pointed out, the term infodemic describes a state of overabundance of information pertaining to an event, whether that information is true or false. So in the current environment where we do not have a vaccine or validated medication for the pandemic, the mitigation strategies are heavily reliant on the behavioral measures. For example, personal hygiene, quarantines, social distancing, etc. And as we have seen in the case of vaccination cases for the previous pandemics such as SARS and MERS, communicating the most basic piece of information to the public could be a challenging task. And moreover, due to the amplifying nature of the social media, which can disseminate a piece of information to millions of users in a relatively short duration of time, misinformation can spread very quickly, creating a so-called infodemic and jeopardizing the public health. So we have launched a preemptive and proactive public communications campaign called Facts Before Rumors. Facts Before Rumors collects the validated information from the countries that have already faced the infodemic. It collects it and spreads it to the nations or areas which haven't seen the same infodemic as of yet.
I see. Let's take a look at some of the information on that list then. It says that you can test yourself for COVID-19 by holding your breath for 10 seconds. What is the origin of this rumor?
When we talk about rumors, it is rather tricky to establish and pinpoint the cause of the rumors. There could be wide variety of reasons for a rumor to start propagating. It could be a deliberate attempt by someone. It could be an honest mistake. The reasons could also lie in the local cultural and social practices, etc. But the thing is, we noticed that same rumors are propagating in multiple countries and multiple languages. For example, Chinese, Korean, English, and so on. So if we could make the timely intervention in these, so we can prevent the harm that is caused by such infodemic. So for example, you talk about the 10 seconds rumor, right? So let us suppose there is a person who is infected by COVID-19 and he believes in this rumor. So he can test himself by holding his breath for 10 seconds. Let us say he passes this false claim. but he would feel that he's not infected, and he would go about meeting people, attending meetings, etc. So you can imagine like how a simple piece of information can jeopardize the whole public health.
Right, and speaking with jeopardizing public health, Professor Lee, there are also rumors that spraying yourself with alcohol or chlorine could kill the virus. What are your thoughts on this?
Well, that was a rumor I think that was spread, I think partly because people were reporting that President Trump made such a statement at a press briefing at the White House. But I think if you sort of look carefully at what he actually said, I think he was responding to a Department of Homeland Security briefing that suggested that UV light, obviously disinfectants on surfaces can kill the virus, and he was surmising, I think, pontificating at the time that maybe this is something we could explore for human testing. So I don't think he was actually advocating for the use of it on a person. But of course, since the President of the United States is saying this in a press briefing, there are some people who are going to, of course, take this as advice to then use it on themselves. And unfortunately, there have been, of course, cases where people have actually ingested these disinfectants or sprayed it on themselves to their harm. Now, I think any reasonable person, of course, listening to this would not use these kinds of disinfectants, but because it has this amplification effect in the media and it's reported, people then take it as advice that they should apply to their daily lives and I think jeopardize their own health.
Professor Lee, staying with, do you believe that the recent pandemic has perhaps aggravated issues surrounding racism or maybe pre-existing geopolitical tensions across the globe? Do you suppose it's aggravated those issues?
I think it has. I think to a significant degree we see cases where, of course, racial discrimination because the people who were identified as being, let's say, Chinese because of their Asian descent had been identified as carrying the virus. And unfortunately, because of, as you mentioned, pre-existing biases, prejudices, in chaotic situations such as this, unfortunately brings out the worst in people. And what we see here is then people acting out on these prejudices in a way that is unfortunately violent to the people who are the targets of this situation. And in terms of the geopolitical circumstances, I think there's clearly an issue with respect to China because I don't think people trust China at this moment. And given the recent meeting at the WHO through the World Health Assembly that President Moon spoke at, there was a resolution drafted sponsored by Australia and the European Union, which didn't mention China by name, but clearly people understood that an investigation should be had as to the origins. And so if China was more transparent, the idea would have been maybe this pandemic could have been reduced in its impact.
Right. Dr. Singh, the outbreak in India is of much global concern at the moment as well, given its population. Could you tell us a bit about the situation there?
Sure. So right now there are more than 100,000 confirmed cases in India, and the fatalities are over 3,100 right now. But government had imposed effective nationwide lockdown in the 4th week of March, which definitely slowed down the growth of pandemic. And nowadays, the restrictions that were imposed in the lockdown are slowly being eased in a phased manner. So government did what it could to slow down the growth of the pandemic. And as we are talking about pandemic, we should also talk about the infodemic in India. So like infodemic, like any other country, is also an issue in India, and I have seen many claims related to COVID-19 doing rounds on social media as well as the personal messaging apps. So in addition to the widespread rumors that we often see, so an interesting example is how an appeal by the Prime Minister of India to show solidarity with the medical staff for their services was falsely propagated as a corona beating tactic. So people believe that. So there are other issues that have caused a lot of social and economic problems. For example, consumption of chicken, or related to cremation or burial of people who were infected by COVID-19. But as of now, the administration is on vigil due to the seriousness of these situations, and they are already taking the legal actions against people who are deliberately trying to spread the misinformation and cause public harm.
I see. And aside from the legal repercussions that such people should face, Professor Lee, we have cases here in Korea where sometimes infected people provide authorities with false information regarding, for example, the occupation. This is by one clubber in Itaewon who ended up infecting lots of people, recently including a taxi driver and his wife, and this former taxi driver came into contact with more than 140 people, it's been said. What kind of legal consequences should such individuals face, in your opinion?
Well, the Korean government has passed a law some years ago to address these pandemics like MERS and SARS, the Infectious Disease Control and Prevention Act. And that is the main legislation that is addressing the issue from a regulatory standpoint, and also, as I think you implied, the sort of criminal sanctions potentially applied to people who do not provide accurate information as to their movements, as to whether or not they've been infected, and whether they've attended places where infected people have been. And so under this act, there can be a criminal sanction applied to people. For example, a criminal fine can be applied to persons up to a certain amount of money, a significant amount of money, actually 10 million won in fines, as well as up to a year in prison for providing this false information. And so there can be very harsh penalties applied to people in those situations who don't comply with the measures that are imposed by the government with respect to providing this accurate information. And it's unfortunate that people don't take this seriously. And I think that's why we need the force of law in some of these cases where people are not really considering their neighbors, they're not considering the public at large, and given the need for solidarity in these kinds of problems, the law is there to back up the needs of society to punish those people who do not actually then comply with these measures.
All right, well, that is good to know. All right, Professor Lee, thank you very much for your thoughts, and Dr. Singh, thank you very much for being with us today.
Thank you so much.
수고하셨습니다. 악수 못할 것 같습니다. 인사만 하고 가겠습니다.
Right, and that brings us to the end of Tuesday's edition of COVID-19. Be sure to tune in tomorrow when we touch upon the world leaders' respective interests in Korea's containment efforts amid the pandemic. In the meantime, do share your thoughts and inquiries with us through our social media accounts or our homepage, arirang.com. Take care.